Welcome to the Codecast podcast. Real-world insights for your daily medical coding and billing processes. And now, here's your host, Terry Fletcher.
Hello, everyone, and welcome to the Codecast podcast today. My name is Terry Fletcher. So today I wanted to bring something to your attention that you may not know is going to take place one after December 15th of 2025, and then one after January of 2026. And it's important to a lot of practices out there. And this has to do with prior authorization. And you would think that that's just something for Medicare Advantage plans and plans that have commercial involvement in them, but no, actually we have something now that's going to start with Medicare. So starting January 2026, Medicare will begin testing a new prior authorization requirement for 17 high-risk services in 6 states under what they call a demonstration program called the Wasteful and Inappropriate Service Reduction, WISR, model. So this program represents a shift towards increased oversight for traditional Medicare, which we know has a lot of fraud, waste, and abuse, and which historically has had very few prior authorization requirements compared to Medicare Advantage plans. So the rationale behind the change is that the initiative is intended to protect both Medicare beneficiaries and, of course, taxpayers from unnecessary services and fraudulent billing. They want to focus on services with high rates of improper payments, and CMS hopes to increase efficiency and wasteful spending with this model. So the model will last for 6 years and will be overseen by the Center for Medicare and Medicaid Innovation, CMMI, which tests new payment and service delivery options. So what's in this pilot program? So states and services in this pilot program, it applies to healthcare providers in Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. The 17 targeted services and procedures, they were selected because CMS identified them as being particularly vulnerable to fraud, waste, and abuse. And we're just talking about Part B professional services right now. So they include, and the first one you're going to be like, oh yeah, I saw the changes for this, so I get that. Skin and tissue substitutes, electrical nerve stimulator implants. Next one surprised me. Knee arthroscopy for knee osteoarthritis, deep brain stimulation for Parkinson's disease, epidural steroid injections for pain management. They feel that these are getting out of control. And then cervical fusions of the neck. So those are the main areas in the targeted services. And I said 17 targeted services and procedures. Those include, they're not limited to, but those are the areas that you're going to see. And there are, on the epidural steroid injections for pain management, there's several codes. So they should have actually said how many codes there were. Now, on December 15th, CMS will also launch another prior authorization program, but this one focuses on ambulatory surgery centers, so ASCs, and a 5-year prior authorization demonstration. They call this one for certain ASC services, and this will be targeting services in California, Florida, Texas, Arizona, Ohio, Tennessee, Pennsylvania, Maryland, Georgia, and New York. They went to the states that have the most ASCs built and working and running. So according to a September 3rd notice, the targeted procedure categories will be blepharoplasties. I'm going to have a little hard time pronouncing some of these. Botulinum toxin injections, also known as Botox. So we knew that was coming. And then we also have panicolectomies, rhinoplasties, and vein ablation procedures. Now, I've also already been involved in OIG audits for vein ablation procedures, because remember, it's not just the procedures, it's what leads up to it. You have to make sure you've started with conservative measures like compression stockings, physical therapy, hot and cold packs, exercise, elevation. And a lot of providers just go right to the ablation procedures themselves. Also, I've noticed that there isn't, after they've done if there has been the conservative measures, then there should be an E&M service saying, how did this go? And a full and complete exam to figure out, what the next step is. And usually I don't see that either. Usually I just see them go straight from anything they tried right into scheduling the procedure. So a lot goes in with these prior authorization requests. And ASCs may begin submitting these requests on December 1st for dates of service on or after December 15th, 2025 start date, which to me makes no sense. If you didn't start it on December 15th, then how can you, really, I kind of get what they're saying, that, if you're going to schedule the service at December 15th, not bill it, then you can start December 1st putting in that request. But I can almost guarantee that CMS probably won't even look at it till closer to that date. CMS also clarified, and this kind of holds you hostage a little bit if you do any of those services, clarified that prior authorization for the ASC is voluntary under the demonstration. However, facilities that choose not to participate will have applicable ASC claims, and they will be subject to prepayment medical review. And we all know what that's like. So make sure that you are, checking this out. You are looking at the program to see if it's going to affect you. You want to go to, let me find it for you here, cms.gov/priorities/innovation and /innovation-models wiser. And then also in the Federal Register, it has something from July 1st, 2025, and it is the change 12195. So at info.gov. It's important to make sure that you know these things. Otherwise, there could be a lot of issues upcoming for you. Now, I know a lot of you did not end up taking our, mine and Stephanie's telehealth webinar, and you should have, because things are going to change here in a week. And so we still had, a healthy number of people sign up for it. I think we had about 50 people, but it should have been a couple hundred. So, make sure that you are asking us or figuring out a way to get the audio of this webinar, the on-demand, I should say. We're going to repeat it in December, but if you don't know the changes for October 1st, you're going to be in big trouble. We're reverting back to the previous geographic restrictions, the previous location restrictions on where you can provide service, limitations on scope of practitioners who can provide telehealth services, and the fact that people are just like, maybe this will happen, maybe it won't. I check every day on the House and Senate calendar to see if there's been any kind of movement in telehealth, or if there's a bill or anything that shows us what's happening. And the only bill that has been heard was the H.R. 1107, Protecting Veteran Access to Telemedicine Services Act of 2025. It has passed the House, but that was introduced in February, and it just passed the House. But the only thing this is for veterans, and it's only about their prescription drug eligibility for patients who are under behavioral health services. So it just talks about, do they have to have an in-person medical exam? It has to be, they can basically wait that 6 months as long as the provider that's seeing them are authorized to prescribe the basic class of controlled substances under an active, current, and full unrestricted license and certification. They are part of their practice, so they're part of they call it a usual course of professional practice, and delivering, distributing, or dispensing substance for a legitimate medical purpose. But this is for, under telemedicine, this is just for behavioral health. There's nothing on the calendar. And right now, the Senate and the House and everyone is fighting about trying to pass a bill just to keep the government open, and who knows if it's going to. They don't like this current administration if you're on the Democrat side, and the Republicans aren't willing to fund, health care for anyone who's not legally here in this country. And so, it's just back and forth. Everyone's not happy. So they haven't even looked at telehealth. It's not on the calendar. So it is going to expire for about 85%. Eligibility is what I'm talking about. 85% of people who now enjoy telehealth benefits. So you need to find the information. We still have it on demand, or just, take your chances if you are finding things just on the internet. But I strongly urge you to at least try to get, a copy of that. We do have pricing for that. You can't have the CEUs if it's on demand, but we still have it available for you if you need it and want to purchase it. So just let me know. And that's Terry Fletcher's CPC at AOL.com or Terry Fletcher's CCC at gmail.com. Either one, you can get me. Okay, well, it's a short version this week. I just want to let you know a couple of things that are coming up on the pike. And I hope everyone had a good September. We are now in fall, so hopefully we'll see a little bit more cooler weather. I know I'm looking forward to that. And we will talk to you in October. So everyone, have a good rest of your week. Make it a great day. And thank you for listening to the Codecast podcast.
For more information on medical coding, billing, auditing, and compliance, including how to hire Terry, follow Terry on Twitter at TerryCoder1 or visit her website at www.terryfletcher.net. Podcast producer Joe Kuzma. Music producer Dassassin Music.